We're back again. Um, and I'm letting you know this is a show that we, me and Mel, put together to inspire, to motivate, to uplift. And this is a show that where we let
Partially off.
everything goes its own way. We not cutting this. We whatever it is you see here, is whatever it is. And so, like I say, we got the Talmud Association, and they celebrating I month. And so I'm gonna let Melanie. Oh, sorry, President. What's your name again? Sorry, make sure.
Talia Gordon.
Talia Gordon. That's the president of the Eye Association. And you know, Melanie was one of the founding members of the association. So I'm going to let her drill these folks today, and then I will come back. But it's so happy to see them here. And you know what is so beautiful about this is that they finally spend a good half an hour with us under the tree,
Hmm.
where the nicest breeze. They can find any fruit they want. We got banana, whatever here. And so we even got live dogs. So now I can tell you, and I can say this to you. Now, you're all here today. So if you see a snake here, they live here.
Wow.
They
Okay.
just pass through now and then. They live here.
Okay.
So I am here, and I can take care of that.
Okay.
So you don't got to worry. So
Okay.
Melanie, you got the president.
Okay. Well, Italia, thank you so much for um, selecting our show as one of the forums for promoting the
World
um,
Sight Day.
International World Sight Day and also blind
Yes,
awareness
awareness.
in the Bahamas. So I want you to just tell the viewing audience a little bit about the society, the Bahamas Society of Ophthalmic Nurses.
Good day, everyone. It is a pleasure to be here with you, Mr. Williams and Dr. Lightburn. I would firstly like to just thank you for allowing us to be here. And as we celebrate World Sight Day, I'm just elated to express my views and what the society is doing to promote the awareness that needs to be given to the world and the Bahamas at large. Firstly, the Bahamas Society is a society that comprises and consists of ophthalmic specialist nurses and allied health professionals. We are also a society that promote the awareness for the prevention of avoidable blindness while working in the community with other private NGOs as it relates to promoting eye health. I would also like to say that the society has reached the scope of the other islands in regards to Freeport, where we have persons there also a part of the society promoting the awareness for eye health. And our travels have also taken us to the islands of Exumer and Eleuthera, where we conducted free eye examinations and screenings and referred persons to the necessary NGOs and partners that would have assisted persons in regards to helping to preserve their eyesight.
Okay. And tell us a bit about some of the activities that is being organized and delivered to increase awareness in the population. When is World Sight Day and what are some of the activities?
World Sight, World Sight Day this year is being celebrated on Thursday, the 13th of October. And also, that day we will be highlighted on the Spence Finlayson show, in which we will be accommodated with special guests such as persons from the Blind Alliance, and
Okay.
also we will be focusing on the disease processes and the preventable measures on the show, along with Dr. Dean from MJB Optical. And that will start the highlight of World Sight Day activities for us. On the 14th, we're going to have a symposium that's going to integrate the community, the laypersons, health professionals, NGOs, and persons from all aspects as we bring the awareness that is needed for eye health, and so that persons will be on point and on par with what we are presenting to assist persons in the blind community. The 15th, we will be also highlighting the Blind Alliance, which is the alliance that advocates for persons in the blind community. And we will be showcasing those persons in the mall at Marathon from 10 a.m. till 8 p.m. And we also having free eye screenings during the day. And also we will also refer persons who need assistance on that day. Our church service is slated for tomorrow, so if anyone's in the area of John F. Kennedy Drive, you can come and join us. We're going to have our church service to open up Eye Awareness Month during during tomorrow at the 9 a.m. service at the Bahamas Harvest Church, JFK Galleria Plaza. And we have many more radio shows that we are going to participate in with the Blind Alliance.
Okay, so all of the radio shows are geared towards raising awareness, increasing knowledge about the common causes of avoidable blindness. Is that right?
Yes, ma'am.
Okay, we have joining us the immediate past president of the society in the person of Mrs. Tamara Donaldson. And let me say that both of these nurses are actually employed in the government service in the Department of Public Health. They are very pro prevention when it comes to eye health. And so I'm going to ask Mrs. Donaldson to tell us about the importance of the observance of World Sight Day and the importance of the society as a whole as it relates to World Sight Day.
So it's very important, and the reason for that is because if the society continues and create awareness throughout the community, it starts a conversation with persons in the community, and hopefully it will fall on areas where it is needed. For persons who may have underlying illnesses that may lead to blindness, and the fact that most cases of blindness is actually avoidable. So for example, about 80% of global cases for blindness is avoidable. And unfortunately, 90% of the persons who are blind are in developing countries. Okay? So that's impactful. So if you have organizations such as the Bahamas Society of Ophthalmic Nurses, and we're actively involved in the community, you're reaching out to persons that may not otherwise access care or may not know of care because of communication, transportation, disabilities, things like that. And so the good thing about what President Gordon have been trying to initiate, not trying, but we have been doing it, is reaching out to persons not only in New Providence where most things happen, but actually accessing the Family Islands. So I'm happy she shared that already. And like I said, it's starting the conversation. So when we first started, well, of course, nobody knew about BSON because it was just starting. But now it's becoming a household name where persons, when they associate BSON with something, it's giving hope.
Okay.
All right. And even in terms of if we may not be financially capable to meet all of the needs in the community, we can link you to care.
Yes.
So our members are from public health, like you said, Ministry of Health and Wellness, Public Hospitals Authority, and also the private sector. We have persons who are working in private sector, and we have persons who already are retired, but they're still giving a lot of education and other encouragement to the community and the society. So I would say this is a society like this is quite instrumental in the community and our approach to avoidable blindness.
Good. And President Gordon, can you tell us a little bit about who is at risk for eye conditions, especially those that could lead to blindness in our local community, which basically coincides with the global forum?
Everyone is at risk, and we do advise that those persons, especially in the chronic non-communicable disease areas, who are diagnosed with hypertension or diabetes, we also specify to them that they would need to check the changes that will occur as the disease process occurs in their bodies. As we know, a lot of persons don't like to attend doctors, and so only when something is wrong they usually go. And so, just how the elevation of your glucose or your pressure levels increases the circulation and decreases the circulation throughout your body, you decrease the amount of oxygen going to the vessels in the eyes, and therefore you can also have symptoms occurring like blurriness, halos, pain to the eye, redness, and these are the non-communicable diseases that can lead to blindness, and it's called hypertension and diabetic retinopathy. So over a period of time, you will find persons that are diagnosed with these diseases having these symptoms, and sometimes the time it takes for them to go to the doctor, it's already later and it's too late.
Okay. And Mrs. Donaldson, how important is it for persons to have their eye tested, and at what age should they begin to have eye testing?
Well, it's very important. It should be a part of a routine exam. And I believe that members in our society were trying to advocate for something like that to happen. So every human being supposed to be having an annual examination if they are normal, meaning they have nothing chronic going on. Otherwise, it should be a part of your exam every time you go and you see a physician. It's very important because many times ailments that are there, you're not aware of it unless you're told. Because many of these are connected to silent killers, like we know diabetes, hypertension. You don't know you have it sometimes.
Okay.
So as early as a person, when newborns, they enter the world, they have other conditions that may also affect them. And so they have a very comprehensive examination by ophthalmic surgeons, I know, in our country, and that is just a routine exam that should be done. And so as they go through their milestones, attending clinic for immunizations and other things, eye exam should not be left out. That should be something that is just as important as head circumference, your height, your weight, things like that, to make sure you're developing properly. So from as early as you hit this earth, you should be having examinations. If you have a family history of anything going on, then of course you should have schedule your appointments in a more tight way.
Okay.
Yeah.
We hear the term silent killer when it comes to high blood pressure, but then we have also heard about the thief of sight,
Correct.
which is a silent thief of your vision. Can you share with us what this condition is that steals your sight?
So that would be glaucoma. So glaucoma is sometimes called the silent thief of sight. And the reason for that is because most persons have absolutely no symptoms. They're feeling quite well until their sight is drastically affected or it's eliminated completely. Some persons complain of waking up blind, and they were never able to regain their sight. And so that is something that is quite popular in the Bahamas. And so you would want to have the conversation with family members, older persons who are putting medication in their eyes every single day. You need to ask, what are you putting drops in your eyes for? They may mention that they were diagnosed with glaucoma. And so, in saying that, compliance is something else with that, because some persons say, oh, the doctor only gave me a month's supply or 3 months supply and I didn't need it anymore. But it doesn't mean that your glaucoma went away. You were supposed to return before your medication was finished so that you could have a follow-up. That is the reason why you didn't have sufficient to last for a long time.
Right.
So glaucoma is something that really affects Bahamian residents.
Right. And Miss Gordon, how long should a person with glaucoma be on medication?
They're on medication for life. It's
Okay.
irreversible, and so therefore you encourage adherence, because once they come off, symptoms may not subside as it relates to for them to see it visually, but eventually at the back of the eye, we don't know what changes will be going on, so we encourage persons to continue with their medication until.
Okay. All right, so as we continue, we just want to say hi to those that are viewing us, our regular followers. I understand there's Beryl there, and there's also Sandra, who has um, indicated um, that they are watching. Now, Tony has a question that comes from one of our viewers, and so I'm going to invite him to come.
They want to know why after surgery you have to polish your eye.
Oh,
Polish
the
it.
person wants to know why after surgery you have to polish your eye. Now, after surgery, it is not a routine that persons have to have their eyes polished, and I'm putting that in quotation because what the polishing of the eye is a term that the physician would use just to help the person understand that the cloudiness has returned in the segment of the lens that was left in place during the surgery. That's called the posterior capsule. And so what they do is sometimes they have to go in and just do a little minor procedure that will allow the light to pass through that blockage. Sometimes the lens itself, the artificial lens that is put in, sometimes there is a little haziness that occurs, and that's the only other implication where that there might be some polishing taking place, but it is not a routine um, post-operative procedure. It's just that for some people that cloudiness appear, and so the physician have to go back in and try to enhance the vision so that they are able to continue to see. Thank you for that question, Sandra. Um, and so I want to find out from Miss Donaldson, Mrs. Donaldson, what are some of the common findings when you go into the community and you do screening? What are some of the findings that you encounter?
Well, you may find a lot of persons complain of flashes sometimes,
Okay.
seeing things there, sparkling lights, things like that, or some persons may even complain of, not a lot, but you have some persons that may complain of a curtain or a part of their vision that is actually not there.
Mm-hmm.
Persons complain of burning eyes. We have a lot of dry eyes, red eyes, and then something that else that is common in this region is a fleshy growth that is on. You may see it when you look into the mirror.
Mm-hmm.
They complain of that, and then of course you have the cloudy lens
Mm-hmm.
and difficulty seeing. Definitely difficulty seeing at night. I'm sure
Night vision.
right, problems in the night with vision. So that is the issue. But we do have persons, lots and lots of persons who require glasses,
Yes.
and they don't have the glasses, and so they're squinting a lot. You'll see them in the food stores. They may ask you to read something for them. These persons can read, but they
Right.
just cannot see to read.
Right. Okay.
Yeah.
And is it possible for you to explain why they are having this difficulty? Is it the same reason for everyone, or are there different implications for why they're having this difficulty?
So yeah, it would vary. Let's say, for example, if you live long enough and you're headed in your late 30s, going into 40s, um, most persons would require readers. The body is aging from head to toe, and the eyes are no exception. And so we sometimes require readers, and so you see persons hanging it on their blouses or keeping it nearby. Now that is different from someone who's a child who may be in school, that they may be having trouble either seeing their books in front of them, so they may complain that I can't read my book properly, or they can't see the board, which is common.
Mm-hmm.
Okay, I know we had some T-shirts made up with
If you can't see the board, then
Yeah.
You can't.
Right, you can't learn if you can't see the board, and that is actually powerful. So we have persons complaining of things like that. So nearsightedness, farsightedness,
Astigmatism.
yes, astigmatism, and so some persons also have injuries to the eyes that may cause difficulty seeing properly for whatever reason. There are so many structures in the eyes, and even as a nurse, I was not aware of as much of the eye until I got into the ophthalmology nursing. It is really, really involved, and there are so many structures where things can go wrong, either through injury or through disease. So there are some of the main complaints we may hear about that persons may say when they enter the clinic, like President Gordon is at the community clinic, and persons may come in for something else, and they're still complaining about the eyes. So you have, as a healthcare professional, you have to connect the dots, you know?
I just want to piggyback on what Ms. Donaldson was saying about the common complaints that we see. Working at the clinic, I can tell you, and I can attest personally, we have everyone coming there. Road traffic accidents. The first thing I'm not checking for is the trauma as relates to the fracture bones. I'm looking at head injury. So once I see head injury and we put that collar on, I'm looking at how your eyes and your vision is also being affected. And so persons, the normal person would just look and say, okay, we're just checking for fractures. We're just checking to see if he can move his neck, to see if he's hurt. But you also need to assess the eyes, because that person can be unconscious for a period of time and you don't know how long they were lying there unconscious. And so you have to specify when they're referred to A&E or whatever facility we refer them to, that they check and do a CT scan to check also for visual acuity, because that's very important. We also have the children that come in. They're not coming in just because the nurse who was working in the school system has referred them. They're coming in because they literally can't see the board. And so in the public sector, I will definitely tell you, a lot of our kids are being affected from the Zoom link as it relates to the platform that they were on. And so we have a lot of complaints coming in from that area. And so the astigmatism, the nearsighted, the farsightedness, we have kids that are only counting fingers because of the complaints that have been occurring because of the Zoom platform. So it's just important to make sure that once you're checking these persons, you check from head to toe, and eyes definitely have to be a part of the physical assessment.
Okay. Well, I appreciate you mentioning the varied possibilities that persons can suffer decreased vision or even sudden loss. And the road traffic accidents, there are also other persons that basically need to be mindful of protecting their eyes. And who are these persons that are at risk for injuries aside from the road traffic victims?
Definitely, you have persons working with hazardous equipment, driving heavy equipment. The persons who do the drilling, the welding, if they don't wear the protective goggles and the protective gear, they are definitely at risk for eye injury, because those pellets, even as simple as them drilling, that flashing is very it's a very constraint issue when it comes to how it affects the eyes. They may say, oh, it didn't bother me today, but later on when they do a physical or a comprehensive eye exam, they will see how it affects the eyes because of the protection not being there. So we also ask the construction workers, definitely mixing that cement, all of those persons, to understand the type of chemicals that are involved. And because of these chemicals being exposed to the eye, you will have issues, if not now, later on. And so we definitely have to educate these type of workers as it relates to eye protection, to ensure that they wear their protective goggles.
Okay, very good. And I know that the society has had many fundraisers. Tell me about any partnerships that you have, and also what kind of partnerships you're looking for in the future. So if there be anyone out there who can help, you can basically share with them how they can help and what they can help with. And both of you can actually respond to that.
Well, so far, I definitely can say that BSON has had many fundraisers over the period of time that we've been in as an institution, as a legalized institution, organization. And I must say that we have reached out to persons like the Rotary Club in particular because of their mandate and their plight to help children in the community when it comes to free glasses and eye screening. And so they would have been the number one corporate sponsors as it relates to helping children in the community needing eye health as the number one factor to get glasses. I would also like to say that we partnered with the Lions Club, who also did an excellent job with assisting us with getting glasses for the children in the community. Recently, we have partnered with Dr. Sama from the Exoma Diagnostic Center. He has been one of the ophthalmologists who has played a pivotal role with screening our residents in Exoma at a discounted rate. We also had sponsors from I'm thinking his name is Dr. Rogers. He is from the Vision Center in Harbor Bay.
Pearl Vision.
No,
Or is
not
it
Pearl.
it used to be Pearl Vision.
Yes,
Sorry,
Vision. I think it's
Bahamas Vision.
Bahamas Vision Center. I'm
Yes.
thinking, and he also helped us with a few of our fundraisers and functions. He did not attend, but he was there to assist by donating his checks.
Okay.
And so we must say that those checks went a long way because we have been able to assist the two children so far in their route to Baskin Palmer where they needed extra added care. And we are so proud to know that the public are aware of what we're doing now and they're understanding the plight for why we need funding. Corporate sponsors is what we're really looking for because of our adult population. As you know, the adult population have so many issues going on where they need surgeries, where they need correction for refractive errors, and as you know, glasses for adults are very expensive. And so if we can get corporate sponsors to assist these persons in the working population especially, because it's so sad when you have persons coming in, they cannot afford it. And so what can we do besides refer them to the relevant eye specialists who will have to assist at some point by giving them a down payment plan of option. So the most we can do is to assist them, but we want to know that at the end of the day that they have the surgery and funding wasn't a part of them for not getting the help that they needed.
Okay. Anything you want to add, Nurse Donaldson?
Yeah, she mentioned corporate sponsors already, but we can involve the entire community, persons like you, because you work at different organizations. Some of you work in government departments, and so many persons have health fairs. Actually, persons have health fairs all the time. Include eye health in your health fairs. So if you're promoting cancer awareness, autism, whatever it is, even allergies. And allergies have a significant effect on the eyes as well. We don't want to leave out anybody. Persons with disabilities. Once you're having a health fair, call on PSON. Call on the Ministry of Health too. We work Ministry of Health, Public Hospitals Authority, where you have these specialty nurses that can be utilized in the community, and they're willing to come out and to assist. So all you need to do is mention it. This is good, what we're doing today, because we're having the conversation and it's going out. And so you want persons to know how important it is and how little you could give, and that can go a very long way. So some persons may say, I can't help. But if you can purchase a t-shirt, purchase a ribbon, or just give and say, I want to sponsor one child or two children, and we're not going to leave out persons like other clubs that have been trying to assist and include us in their health fairs. I think also the Royal Bahamas Police Force, just calling out for assistance with their health fairs, and other doctors' offices, and lodges or whomever. You can just call on us and we'll be able to assist. She mentioned already that eye care for adults is very expensive. People tend to want to help children, and then the adults get left out. Some adults, because they're unemployed, they may have disabilities, or they have so much other responsibilities, they leave their eyes for the last. So if you want to feed your children and do other things, you're going to say, no, I'm not going to buy that $400 glasses. But those things are important. Remember, we opened in the statement saying that avoidable blindness that accounts for the majority of cases.
Yes.
Most of that are refractive errors.
Yes. The majority
Meaning
of it.
persons need glasses. That is why they are having low vision. So October is centered around eye health. It's sight awareness, but it's also blind awareness.
Right.
We have many persons that are already blind in the community, and so organizations such as Mr. Rose, you remember his
Bacadas.
Bacadas and also Babving, they are instrumental in assisting persons, the sighted community, in getting glasses, getting help, or just assisting through health fairs and other things. So we partner with them as well. And so I think that is important. So anyone in the community can actually assist.
Yes, anyone and everyone,
Yes.
because eye health is everyone's concern.
Yeah.
We
Yes.
all have a pair of eyes and it can go bad. And I just want to say we have Valencia Fernanda who made a comment that she worked in the emergency room and she sees the eye trauma that you're talking about.
Yeah.
You know, so we just want to say that vision is very important. We participated just this week in a forum with the Bahamas Alliance for the Blind and Visually Impaired, and there was a young lady in just turned 30 who is now gradually losing her sight. Imagine, she was sighted, she was treated from childhood for what appeared to be astigmatism. It turns out, and she's been regularly visiting the doctor, it turns out that she has a genetic condition called Stargardt's. And so eventually she will lose her eyesight. And so the work that the society is doing is basically to raise and increase awareness. Everyone says the government, the government, the government. We all worked in the government system, and it is out of the deficiencies that we see in the course of our work. We realize that many persons will not come. There are a lot of delays, there are a lot of cancellations, but by us being a private entity, non-government, non-profit organization concerned with preventable blindness, concerned with getting people access to care in a timely manner, because each individual who have lost their sight can tell you it is an adjustment. One person talk about family support. When you're sighted and healthy, you can't get support. So imagine the confusion, the stress associated with losing your sight. And so I want to home in particularly as we wrap up on the diabetic population in our country.
yes.
What is it that they can do? Because there are so many conditions that diabetes itself causes with the eye, but they are all preventable. What is the preventive measures for persons with diabetes in order for them to preserve their sight?
Control.
I would say definitely control, because if you can control your glucose levels, the tendency for the vessels to be affected would be at a minimal, and therefore once the high glucose levels are brought back to normal, you should have better vision, because they usually come in with blurred vision, but they don't know why they're having blurred vision. They think it's just, I need a pair of glasses. No, the vessels at the back of the eyes have already been affected. So
Right.
now you're driving and you can't see in the night. Now you're driving and you had an accident because, wow, the car was right there, but it's like, I didn't see it. So what's going on? Are you checking your glucose regularly? Are you complying? Are you adhering to what is needed as it relates to getting your blood checked every 3 months? Are you checking your glucose every day? Are you dealing with the diet and the exercise? It's not a reversible thing overnight, but if you work at it, you will get the help that you need, and the dietitians are always available to help you to plan your meals so that you can keep your levels at a rate where you wouldn't have this effect on your eyes. So it's not that you're going to turn blind, it's just that if you monitor and continue to monitor, the chances for you to get blurred vision, the chances for you to have retinopathy, diabetic retinopathy, will be at a minimal.
Okay.
Yeah.
And then I'm going to also re-emphasize the glaucoma population. What advice do you have for persons who may not have glaucoma, but they know of members of their family who would have gone blind. You know, one thing I noticed is that people confuse diabetes, the glaucoma and cataract. Can you give them a difference between the seriousness between these two conditions, and what should a person who knows someone in the family that have glaucoma should do in order to preserve, and also the person with the glaucoma themselves, what should they be doing to prevent themselves from going blind?
Okay. Well, when it comes to cataract, that's where the lens of the eyes become opaque and you're not able to see properly through those lenses. So persons, as the lens mature, it can be removed, and so the vision can be improved. And that's why I say in developing countries where persons may not have access to surgeries and other things, they may not be able to have it removed, and it leads to blindness. That's one thing. But then when you look at glaucoma, that disorder results from the difference in the pressure in the eyes, and that pressure increasing in the eyes actually acts on the optic nerve, and you know the optic nerve is responsible for those functions in the eyes. And so if that pressure continues onto that optic nerve, it actually dies. Okay, it begins to die, and the damage there is irreversible, and so the person will start to lose their sight and not know. And the thing is with glaucoma is that the sight goes from the outside, from the borders, right, going into a tunnel. So it's very, very gradual in most cases, so you don't realize it because you're able to adapt to it. But then when you notice that you're keep getting in accidents and bumping into things in the house, and you say, oh, I didn't see that coming, you maybe have that narrowing effect already. And so if you think you have someone in the family that has glaucoma, they have a history of glaucoma, then you may be a glaucoma suspect, but only the ophthalmologist or the optometrist may be able to tell you that in a routine exam, checking the pressures of your eyes. So you actually need a comprehensive eye exam. So you need to go and see an ophthalmologist, which is the eye surgeon, and so that they would be able to monitor you. So they will let you know if you need to have your pressures in the eyes checked every 6 months or it's every year. They'll let you know. And both eyes may have different pressures. So one of the eyes may actually be higher and the other one may be lower. So the medication may only be required in that one eye. So persons tend to get mixed up, put the medication in both of the eyes sometimes, and the medication run out. So if you know someone in the family who have that, then you want to go to and see the doctor immediately. And which brings a point. I know BSON, we need to have those type of tools to be able, in a routine health screening,
yes.
in the community, we need to be able to check eye pressures, because with us seeing hundreds and hundreds of clients, okay, at a health fair or when we travel, you want to have that tool,
Yes.
so that we could put persons into care, direct them, because otherwise persons don't want to just go in and get their eyes screened and say their pressure's done. So we're educating as we go along, and we say things like that, but it's something that has to be done.
Yes.
And I think the emphasis that you would want to place in terms of the tools is that by contributing
Yeah.
to our fundraisers, or even just contributing to the society itself, as a, whether you want to do a monthly contribution or an annual contribution, because the instrument that she's talking about to actually test the eyes for the pressure is very costly.
Right.
And so therefore it would take us some years, especially if we are helping persons to purchase glasses and
Yeah.
to have a referral to Bascom Palmer, or even to go to a local doctor for special treatments. Persons with diabetic retinopathy sometimes have to have laser therapy, and that is not free. And so once persons come to us, they have a legitimate complaint and there's evidence, we do our best to provide whatever assistance we can. The government is not able to at this time. We must say thank you to the government, because these two nurses were trained. I was trained as a result of the government investing in me.
That's correct.
And we have decided that eye health is so important that beyond our work, we will actually form this society to reach more people, to pull more people out of the trenches of losing their sight.
Yeah.
And so, as we wrap up, I think Tony wants to be able to have the final say as it relates to you too. So, we're gonna change roles, but I want to thank you all for the work that you are doing. Past President Donaldson did an excellent job in getting the society up, running, registered. We're now in our third year of existence, fourth year. Wow. And we have a total of 29 ophthalmic nurses that have been trained in this country, and then the others before that were trained out. But I want to put a plea out there to all ophthalmic nurses, retired, those that are in the private sector, those that are in the public sector. Join us, please, in the quest for reducing the number of persons going blind in the country.
Yes.
World Sight Day is one of the platforms that we use to increase awareness, but we want the government, we want civic organization, we want churches, everyone to join in the fight, join in the journey
Yes.
of keeping people independent, because without vision,
People perish.
people perish, literally, physically, emotionally, financially. Without your sight, you are literally doomed for disaster. Tony? Okay.
I wanted to mention, you mentioned churches,
Yes.
and during the pandemic, there were churches that assisted Madam President when doors were closed, when the country practically shut down completely. But eye care had to go on. It was the church doors that opened for us and allowed us to use their facilities, their premises, to have eye screening done, to have these clinics. And so we just want to thank those churches.
Yes.
If I mention one, I may leave out one. And so I don't want to
Mhm.
start at all. But there were
Yes.
many churches from different organized, not just one denomination,
yes.
many who assisted,
Yes.
and we applaud them.
Yes. And we want you to just keep your ears and eyes open whenever you hear BSON or Bahamas Society of Ophthalmic Nurses. We are doing for the community. We give of our own means, we give of our time, outside of our paid time. That's very important for you to know, because that's how important blindness prevention is to us. Early detection is key. And so I want to thank both of you for coming here today, for sharing about World Sight Day, about Blindness Awareness Month in the Bahamas. Any closing remark as we wrap up? Closing remark from both of you? Oh, Tony is an entertaining person. Oh, the rain is coming upon us though. And Madam President has her little daughter who is a soldier with the Bahamas Society of Ophthalmic
Yes, your
Nurses.
daughter.
So we just
Micaiah.
want to give Micaiah
Micaiah.
props. And because the rain is coming down and this instrument has to be closed,
Yeah.
we're going to end here, and we say thank you for joining us, and be sure to tune in again next week at 4 p.m. when Tony and I will resume our regular forum. Thank you again, and goodbye.
Okay.
Well, we had nothing to give, so I picked